Good evening, and thank you for joining us. I'm Shannon Ogden.
And I'm Ann Trujillo. A celebration that may be a bit premature, affecting your family's health care and your wallet. House Republicans squeezed out a victory to dismantle Obamacare, and tonight the bill faces an uphill battle in the Senate, where some moderate Republicans worry about the number of people who could lose their coverage.
Well, the Senate will write its own bill. I mean, that's the way it works, right? And so they'll pass theirs, we'll pass ours, and then we'll go to conference.
Now, the reality is we do not know a lot about the impact of this bill. It was passed so quickly, the nonpartisan Congressional Budget Office couldn't look at the cost savings or even pinpoint how many people would be covered. In fact, all but one of Colorado's 7 House members voted along party lines. The only exception was Republican Mike Kaufman, who says he was concerned about what would happen to the millions of people with pre-existing conditions.
So what does this mean for you and your family? Well, the bill passed by the House today would repeal Obamacare subsidies for lower-income Americans and replace them with refundable tax credit based mainly on age. It would also eliminate individual and employer mandates, end Medicaid expansion funds starting in 2020, and weaken guaranteed protections for people with pre-existing conditions. Now, if the burden for insurance falls back on the states, here in Colorado, you may have to decide if your taxes should be raised to pay for it. Denver 7's Jaclyn Allen is live, and Jaclyn, in our state, Tabor, the Taxpayer Bill of Rights could complicate this even more.
Well, because of Tabor, any kind of tax hike to help pay to cover those cutbacks in health care will have to be approved by a vote of the people, and that could pose some serious problems.
What a pretty day, oh baby.
Marilyn Sorensen is one of more than 2 million Coloradans with a pre-existing condition. Many like her now worried about the future.
If I can't even afford to take care of myself, what am I going to do?
Under the House plan, insurance companies will share the cost of covering pre-existing conditions with states like Colorado.
I'm very worried about it.
Lieutenant Governor Donna Lynn, a healthcare expert, says finding that money is even more complicated in Colorado. Here, Tabor, the Taxpayer Bill of Rights, requires a vote of the people on any tax increases.
So the legislature would have to work with us on, going to the voters to say, do you want to fund more money for health care if we were to attempt to preserve what we have?
If Colorado voters don't approve more money, she says the state would have to cut eligibility or benefits. And that's what so many are now afraid of.
Where it is in Washington, it just doesn't seem like they're hearing the people or they care right now.
And we don't know all the costs yet, but the lieutenant governor says ending the Medicaid expansion alone would cost the state of Colorado $1 billion a year. Reporting live, Jaclyn Allen, Denver 7.